So this is a topic that is very near and dear to my heart. And I'll tell you a little bit about that as we dive into it. Oh, I got another chat. Hang on, stand by. Kids included. Kids can join if they want to. It's going to be kind of we're going to talk about some kind of grown-up stuff, some kind of scary statistics. And so if kids want to listen, that's fine. But you may want to have some conversation afterwards about some of the things that we're talking about, because we're going to talk about some of the risks and some kind of scary numbers, and some things that we can do hopefully to hold off on addiction when you have ADHD. So I leave it up to you. Okay, so the topic tonight, as we said, oh, here comes somebody else, sorry. I was afraid this was going to happen, is ADHD and addiction and why it's important to treat your child now. Oops, now I have to make sure I'm advancing. There we go. So this is the ADHDKC and CHAD disclaimer. Our ADHD support group does not endorse any products, services, publications, medications, or treatments. We encourage you to do your own research and check with professionals to find out what evidence-based treatment looks like. This is another disclaimer, which basically says whatever we talk about today is not intended to be, medical advice or therapeutic advice necessarily. It's just the research that we have done and we're presented. And I'm going to ask everybody to go ahead and mute themselves as they join so that, oops, now I got to move things around. Sorry, guys. Nope, that's not going to work either. Bear with me. There we go. Maybe. Sorry, technical difficulties. It would be unusual if we had a presentation that didn't have any technical difficulties, I think. Anyway, so this is my list of disclosures. I am on the CHAD National Board of Directors. I am the co-founder of ADHDKC, and I currently serve as the treasurer. I work for Impact Parents as an ADHD coach, and I work for the Jordan Psychological Center as a licensed master social worker and licensed master addiction counselor, and that's a mouthful to say. And I do present for PESI from time to time, and they pay me from time to time. I usually donate whatever they pay me to ADHDKC or CHAD, but I'm required to make my speaker disclosures anytime I talk. Come on, thing. This is a little bit more about me. That's my fabulous family. I have 5 beautiful kids, 4 of whom have ADHD and other neurodiversities. We're going to talk about a couple of them. Well, probably all of them at some point. But the first one that we're going to talk about is this guy here, over here in the kind of plaid shirt. That's Theo, and he's 19 now. He's a freshman in college and doing great. But he is the one that kind of launched us on this whole journey of ADHD. He got diagnosed when he was 3. And I was diagnosed right after he was. And the reason that ADHD and addiction is important to me is because I come from a family of addicts and alcoholics. I grew up in an alcoholic home. Both my parents were alcoholics. 2 of my siblings have struggled with alcoholism and addiction and been in and out of treatment and in and out of jail. And both of my siblings found out that they actually had ADHD when they went to treatment. And had they been diagnosed with ADHD when they were kids or treated when they were kids, the likelihood of them having to struggle so much with addiction and alcoholism would have been greatly diminished. And if they'd had the help that they needed earlier, chances are life would have gone a much more positive, much different direction. And so let's see, just a little bit more about me. We'll come back to that. Is anybody else trying to join? Sorry. This is like ADHD craziness. There we go. People always ask me these questions. You can't see that I'm tall because I'm sitting down, but I am really tall. People always ask me if I played basketball, and the answer is no. I could when I was younger, and all I had to do was like stand there with my arms up. But whenever anybody wanted me to actually dribble move up and down the court, that did not happen. I'm named after my dad's favorite cousin, who was a woman named Jeremy. My parents did not want a boy. If I'd been a boy, my name would have been Rob. And so there's at least one other woman in the world whose name is Jeremy, but I don't know why her parents named her that. So I like to get that out of the way because that tends to bug people throughout the talk if I don't address that at the start. Hang on, I got a couple more people who are trying to enter the waiting room. Oops, bear with me. Admit all. There we go. All right, so let's make that go away. Moving on. Okay, so here's what we're going to talk about. Go ahead and mute yourself if you've just joined us. We're going to talk about what are ADHD, which most of you already know, I'm sure, and what is substance use disorder. We're going to talk a little bit about the current research and data. Why are kids with ADHD, and adults for that matter, with ADHD at risk of developing substance use disorder? And substance use disorder is kind of the catch-all term for addiction, alcoholism, any substance that you're challenged with. And we'll dig into that a little bit more in just a second, but just wanted to make sure that you knew what that was. How to find out if you have ADHD. We already know that one probably, but we'll touch on it briefly. And how to find out if you have substance use disorder. And then what you do if you have one or both, and then what the effects can be of not treating. And I kind of alluded to that a little bit ago when I was talking about my siblings and my parents. And then we'll take some questions if that's cool with you guys. If you do have questions, you can put them in the chat. I won't be able to look at the chat probably while we're talking, but I will check at the end, or you can unmute yourself and ask questions. I love this because Russell Barkley, who was like the grandfather of ADHD, says that ADHD is the most treatable chronic health condition in the world. And the reason I love that is because, one, it's true, and two, we forget that all the time. You know, ADHD is with us for pretty much the entirety of our lives, you know, and it kind of waxes and wanes, and we may need more treatment, you know, some years than other years. But the fact is we have really awesome treatments, and they're successful, and we have an incredible amount of research behind the treatments that are available for people with ADHD. So it makes me happy to know that that's one of the most treatable chronic health conditions in the world. So what is ADHD? No surprise here, a neurodevelopmental disorder that causes significant functional impairment in individuals and often presents with serious comorbidities that further reduce overall quality of life. These challenges are often centered in the areas of attention, impulsivity, hyperactivity, emotional regulation, and deficits of executive function. And the kicker, 80% of individuals with ADHD also have at least one other thing going on. There's 3 types of ADHD, as I'm sure you guys know: predominantly an attentive type, predominantly impulsive hyperactive type, and then combined type, which has, you know, some aspects of both. So how do we get ADHD? Well, it's genetic, highly heritable. The only thing more genetic than ADHD, or the more inheritable than ADHD, is height. And it's also a spectrum. You know, there's lots of people who have ADHD symptoms or have, you know, things that look like ADHD from time to time. But as you guys know, for those of us that actually have an ADHD diagnosis, those symptoms end up causing impairment in at least 2 or 3 major life domains. What causes ADHD is, again, it's genetic. I like to remind parents that this is not your fault. It's your parents' fault. I'm just kidding. You know, every now and then someone develops ADHD through environmental factors. So something like lead paint, or something external that they were unaware of. But it's likely for the most part that nothing happened while you were pregnant that caused it, or that once your child was born and they had some sugar or red dye number 5, that didn't cause it. They were probably born with it. What is substance use disorder? So essentially, it's just what you guys think it is. That's using a substance to excess. So using a substance more than is healthy. And usually that shows up in terms of impaired control. So continuing to seek out the substance, whatever it is, you know, in the face of some negative consequences, and inability to stop using the substance when it's clear that the use is not helping. Continuing to seek it out, spending a lot of time trying to get the substance, whatever it is, needing more of the substance every time, you know, withdrawing from society, having some negative consequences like DUIs, getting arrested, getting in trouble with the law, getting kicked out of school, having relationship challenges. And then if the substance is stopped, whatever it is, experiencing some kind of withdrawal. So some symptoms can be, you know, tremors, night sweats, trouble sleeping, irritability, all the things that you would expect to go along with withdrawal. What causes substance use disorder? Well, there's a bunch of different theories about it. Some people believe that addiction is a disease. Some people believe that it's genetic. You know, you inherit it. If your parents were alcoholics, then the likelihood is that you're an alcoholic. And then there's some people who believe that addiction is a choice or a moral failure. And if you just tried hard enough, you would stop doing whatever it is that you're doing. And I kind of giggle, even though it's not funny, anytime I hear that, because it reminds me of what people say to our kids. If you would just try harder, if you would just focus, if you would just really apply yourself, then you can really do this. And people say the same things to individuals who are struggling with substance use disorder. And in reality, it's, it's a combination of things. The majority of it is genetic, but a lot of it has to do with the environment that you grew up in. And this is substance use disorder, and your development over time. And just like with ADHD, bad parenting doesn't necessarily cause substance use disorder, but it can make it worse. And so we want to make sure that we're talking about the tools and the tips and techniques, that we can use along the way to make sure that our kids have the best chance of success possible. Okay. No shocker here. If you are someone with ADHD, or if you're struggling with substance use disorder, typically that means that you're low in dopamine. Dopamine is like the never enough of neurotransmitters. Basically, it handles the pleasure center or the reward center of the brain. And so when you're low on dopamine, you want more dopamine. And over time, you develop this cycle of need, reward, and it just magnifies. You need more, you want more, you need more, you want more. And so, people have done all kinds of charts that look like this about how much dopamine each activity releases. And, food is not as much as you would think it is. Video games seem to release more dopamine than food. Sex is right around 200%. Cocaine 450, amphetamine, methamphetamine, and then heroin and fentanyl are off the charts. So I've seen that number as high as 2,500%, which is pretty massive. So if you think about it, it's almost impossible to continue to maintain that cycle when you're always chasing, a 2,500% improvement over the previous state. And for people that come from a family where there's a history of addiction or a genetic history of addiction, you're already a little bit lower on baseline. So you need more right away in order to feel better. And so that addictive cycle starts earlier. One thing that we don't talk about as much, but I'm sure you guys recognize as well, that triggers a hit of dopamine is social media. And so for our younger kids that, get addicted to their phones, this is one of the reasons why. That shared emotion experience, that needing to be liked or have the likes or share something that's reinforced again and again also creates that cycle of dopamine addiction. And so this is where I scare you. This is my scary slide, or the heads up that scary slides are coming. The reason that we're talking about this is because, drug overdose deaths in the US are only going up. And it's not just drugs, it's also alcohol. But hopefully you guys have heard on the news or heard stories about, the increase in fentanyl and opioid related deaths recently, and they've almost doubled, which is terrifying. I mean, the numbers are absolutely terrifying. There's some of the statistics on opioid deaths and overdoses. And this one is looking at alcohol and the increase that happened after the lockdown for COVID. So the fastest growing group of people who are struggling with alcohol in the past couple of years are adults over the age of 65 and girls and women under the age of 25. But as you can see, no one's drinking less. These numbers just continue to go up, and it's costing, whether this is important to you or not. I just think it's an interesting thing to think about the economic burden of substance use disorder over time, and the opioid epidemic and the cost of untreated or poorly managed ADHD is astronomical, billions and billions and billions of dollars a year. I throw this in here because the American Society of Addiction Medicine has a definition of addiction that's a little bit different than the one that I shared earlier. And the thing I like about it is that they say that addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences, which is essentially the same as what we said before. But this is the part that I like. Prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases. And if you remember at the beginning, we were talking about what was the most treatable chronic health disorder in the world, and that's ADHD. And another treatable chronic health disorder is substance use disorder. And so I think it's nice to remember that, yes, these things exist and sometimes they can really suck and we have really awesome treatments for both. And it doesn't have to happen. I see this as an area of opportunity. And one of the things that it's important to remember is that 90% of people who have mental health and substance use disorder diagnoses are actually experiencing symptoms, either in adolescence or childhood. And so we know that ADHD shows up on average 10 years before an individual, picks up their first drink or smokes their first cigarette. And so we've got this window of opportunity to ensure that, if nothing else, parents and kids are educated about what the risks are and what to look for. So again, ADHD is the most treatable chronic health condition in the world. So what are the numbers looking like? So roughly, depending on who you look at, 9.5 to 10.3% of the population has ADHD. And of those, 50 to 70% have struggled with substance use disorder at some point in their life. Alcohol use disorder seems to be the most common, followed by cannabis, although I think that number is probably going up. And then other drug use disorders follow behind that: nicotine, cocaine, stimulant addiction. We're not going to talk so much about the behavioral addictions today, mostly just the substances, but those are up there as well. So kids, again, with ADHD are 2 to 3 times more likely to abuse substances than kids who don't have ADHD. Our kids start early. We're overachievers. And they're more likely to use alcohol to excess than their peers are. The reason that our kids start early is because they know they're different and they feel different. And as I'm sure you guys have seen this one before, but kids with ADHD receive 20,000 more negative comments than their same age peers by the age of 12. And so we know the impact that has on our kids and their self-esteem. And it kind of creates this vicious cycle where kids feel bad. They're getting negative messages all the time. They know they're different. They don't like being different. Maybe they're at the age where they are having problems with social relationships and struggling with their peers. And so they start hanging out with the kids that accept them. And maybe they want to do things to stay in the group that's accepted, or maybe they're hanging out with older kids. Sometimes that happens. I'm sure you guys have seen that with your kids, where they get along better with kids that are much younger than they are, much older than they are. And then they want to continue to fit in and they feel different. And so if someone offers them a cigarette, a drink, they're more likely to go ahead and try it because it helps them feel like they are a part of instead of separate from. And obviously starting alcohol or drug use at an early age messes with your brain and your brain development. And we know that our kids' brains are already delayed 3 to 5 years just by having ADHD in at least one major developmental area. And so it develops this again, vicious cycle where you've got kids who have ADHD, they're impulsive, they start drinking, that makes them more impulsive. They start drinking more, they get more impulsive, they engage in some riskier behaviors, and the cycle just continues and continues and continues. And the evidence shows that, the more severe a child's ADHD is, the more likely they are to start using early, the more likely they are to have serious challenges with substance use disorder. And if they do make it into treatment, the more likely they are to relapse. So the combination of ADHD and substance use disorder can be really devastating. Even in places where there's like a high success rate of treating individuals who have substance use disorder, people who have ADHD are more likely to relapse. And they have, not surprisingly, more challenges financially, socially, emotionally, educationally, and occupationally. So it kind of makes everything worse. The other thing to keep in mind is that gender matters. Gender matters a lot in ADHD anyway, but as we already know, girls and women with ADHD are often missed and misdiagnosed, and with devastating consequences because it's a huge missed opportunity. For whatever reason, remember how I said that girls and women under the age of 25 are the fastest growing group, one of the fastest growing groups of people becoming addicted to alcohol. And the reason that girls are more at risk is because they're diagnosed later. They're perceived as less impaired than boys with ADHD typically. Smart girls get diagnosed later because they hide it better. And when they are diagnosed, they are usually undertreated because they seem to be managing pretty well, or they've made it this far. And so they often don't receive the same level of treatment or interventions that boys do. So we already know that girls are diagnosed later in life than boys are. And girls are more likely to drink impulsively when they're stressed and engage in more risky behavior when they're drinking than boys are, believe it or not. And there's a strong correlation, which probably doesn't come as a surprise to you either, between girls with ADHD who are either undiagnosed or not properly managed and teenage pregnancy, highly correlated. Also suicidal behavior, more likely to engage in self-harm. So our girls are suffering. Our boys are too. So I touched on this already. Sorry, those are kind of repeat slides. So what do we do with it?